The idea behind rest came from a few things. Number one is that concussion creates a neurometabolic crisis, aka an energy deficit, a drop in ATP. The theory then is that anything that causes you to burn ATP is going to be potentially detrimental for the brain. So putting somebody into a dark room with no stimulation, with no exercise, and completely shutting things down helps the patient to theoretically conserve energy, conserve ATP, therefore recover from neurometabolic crisis. So that's theory number one. Secondly, rest achieves another objective, which is preventing the person from getting a second concussion. So you have one concussion. We know that during that low metabolic state, that drop in ATP, you are more susceptible to getting another concussion, and that second concussion can cause potentially fatal consequences, but if not that, a compounded effect where you have a more severe brain injury that develops as a result. So telling somebody to rest and avoid all activity and put them into this cocoon therapy achieves an objective of preventing any type of chance for a second impact to occur. And then number three, some early research in animals showed that animals that exercised in the very early stages after concussion had an increase in a deregulation of brain-derived neurotropic factor, which is a healing modulator for brain and neurologic injury. And so preventing or downregulating healing modulators after concussion is obviously a bad thing. Now, this is preliminary work, and that's kind of what set the stage for rest. And for the past, up until about 5 years ago anyway, we were constantly telling patients that the only treatment for concussion was to rest. Do nothing, rest, rest, rest. When that doesn't work, just rest some more. Now, kudos to a group in Buffalo that started looking at the evidence around exercise and concussion, and they started with people with chronic symptoms. Patients are continuously being told to rest, and now it's 6 months out, a year out, 2 years out, and they're still resting, they're off work and all this stuff, but they're still not getting better. So then they kind of flipped it and said, well, what if we tried to have them exercise? And so they started what eventually developed into the Buffalo Concussion Treadmill Test, as well as an exercise protocol that's done in a subsymptom threshold manner, and they found that it was effective. After I think it was like 8 to 12 weeks of this protocol, they had like a 70% success rate with patients that were chronic. And this is, a year, 2 years out, now all of a sudden having tremendous success getting back to kind of pre-injury activities with simply just doing exercise in a subsymptom threshold manner. Now, this is done in a very specific way. So then, from there, they started looking, well, if it works on these patients, what if we were to do it at, let's say, a month out after injury in patients that were still symptomatic? And then that gradually worked its way down to the point where now we found that exercise is beneficial after as little as 2 weeks. There's emerging evidence now, actually a study just out of the University of Toronto, found that patients exercising the day after injury had a greater outcome than patients who exercise 2 days out, and so on and so on and so on. The earlier time to exercise in this particular study found that patients were recovering faster. Now, the caveat to that is that this is self-selected exercise in a lot of these studies, and so patients that are going to select to exercise the day after injury may not have as severe of an injury as those that choose not to exercise, and so you might just be getting that type of response to kind of a self-fulfilling prophecy where patient is getting better faster because they exercised more, but it could be another variable that wasn't taken into consideration, although they did do a fairly good job of controlling those other variables. There was also a study by Ann Gruel and Roger Zemek's group that found that exercise in the first week after injury was one of the most predictive of having of not going on to have post-concussion syndrome.